Team number 2, the Kearney Titans. Our team members include Christian Jackson, Daniel Newsom, Caroline Burke, and myself, Ryan Irizarry. When reflecting on ways to address hunger within the Commonwealth, Team Kearney Titans all shared personal stories about a similar topic, older adults. One team member shared their concerns about the residents in her surrounding area during the COVID-19 pandemic. Older adults are an increasingly vulnerable population due to the health concerns of exposed to COVID. Thankfully, many older adults were able to use the community messaging board to share their cell phone information, and together, residents were able to deliver food to their doors. We were also inspired by Taylor Scott's presentation about RVA community fridges, and our takeaway was the need to identify locations where vulnerable communities, such as older adults, reside, so that these amazing organizations can best focus their efforts in these communities. With these experiences and inspirations in mind, our focus became how we can leverage data to identify communities of food insecure older adults in order to effectively provide the services and support they need. To solution this problem, we created a visual way to leverage data in an effort to provide actionable insights into specific counties that would allow a focus of resources to alleviate food insecurity of older adults in the Commonwealth. The impact of food insecurity is particularly concerning for older adults. The Food Resource Action Center reported that 1 in 5 food insecure households include an older adult. Older adults also experiencing food insecurity often encounter negative mental and physical health conditions, and on average, these older adults are faced with an 11% increase in their healthcare costs. Our actionable insights resulted from leveraging statistics from multiple data sets and used them to create a metric we called the Vulnerability Index. We use this metric to create a statewide heat map that represents our vulnerability index on a per county basis. Indicators include availability of transportation, known food insecurity rates, and access to affordable and nutritious food. Selecting each county gives the user additional statistical insight that can be utilized to direct resources to counties with high vulnerability indices. Now I'm going to turn the presentation over to my teammate Dan, who will show how we leverage the data to visualize our vulnerability index on a map of Virginia separated by county.
So the dashboard you're viewing now provides a view of the vulnerability index among adults 65 and older. On the map is a color scale of the index we've created, broken down by Virginia counties. The darkest color representing the most vulnerable adults 65 and older. This dynamic dashboard is in the sense that when you click on a county, the averages in the top left and the potential correlations at the bottom adjust to a higher level of detail. As you can see though, Highland County has the highest vulnerability index, whereas Loudoun County has the lowest vulnerability index. The factors within our vulnerability index include food insecurity data, food availability data, and access to a vehicle data. From this dashboard, we were able to easily see locations in Virginia where adults 65 and older are vulnerable based on the indicators in the dashboard. Now, identifying these vulnerable communities is a great start to addressing hunger in Virginia. Like so many challenges, data allows government agencies and nonprofit organizations to carry out their most important mission, taking care of the Commonwealth. Thank you for your time and the opportunity to participate in the 2021 Virginia Datathon.